Today we're going to talk about the difference between private insurance and public insurance. Well, there's a lot you really need to know here, and I'm way too much to go into in this short video, but I'm going to give you the gist of it. On one side, you have the public insurance. People really kind of nickname it public, but in reality what they're referring to is the Affordable Care Act marketplace. So we'll just call that the marketplace. On the marketplace, you can enroll in a plan, and the plans vary by prices. They go from cheapest to most expensive, and typically, for the cheaper plans, you're gonna have less access to doctors and hospitals. You're going to have a little bit more of a deductible, which is basically the amount you need to meet before the plan covers you. You might have some bigger copays on those plans. You can enroll in them without any medical questions asked. If you want something a little bit more expensive and you have more of a better budget, or that includes a certain doctor, you may need to go more on the more expensive side on the public insurance. If you really want to keep your same doctors and hospitals, that's really what I see the most of. Now, the good news about those plans is that as long as you're within the enrollment period, which is typically November 1st to December 15th, and keep in mind that could change at any time, but that's where it is right now, or you have what's called a qualifying life event, which is kind of like an exception, meaning that it allows you to get on to one of those plans like at another time of the year based on some kind of a qualifying life event. You can get onto one of those plans without any medical questions asked. All you have to do is, give them your bank information, tell them which plan you want, and you're good to go. You sign up. The premiums are all gonna be about the same based on age. So it's not gonna be based on health, and those plans on the marketplace, they've got to cover, they're kind of standard plans. So they've got to cover certain things that they all have to cover in order to be sold on that marketplace. It's kind of like the rules of them, the standards for them being able to be sold on there, they have to cover these things. So you can bet that they all cover these certain things, and that they're gonna give you free preventative, and they're gonna cover pregnancy, pay benefits on mental illness, and all kinds of things like that. And you can also bet that they're not gonna ask you medical questions. That's a guarantee. So here's where the conundrum lies. Often I get a lot of people that come to me and they say, Alex, I have this really expensive health plan a couple of years back, or now, or present they have it, and I never use it. I'm super healthy, I do yoga every day, I eat healthy, I'm a vegan, I take no prescription medications, I don't even go to the doctor. I go to a private doctor, I pay him out of pocket. What do I really need insurance for? Should I just go without insurance? And the answer is no, because in reality, the deep lying fear of all people when it comes to insurance, and even these healthy people like me, are what if something unexpected happens? What if cancer comes? Cancer can hit anybody. We've all heard stories of that happening in their families or among their friend circles. And so what would happen to that person without any coverage? So here's where the private option is really becoming something more popular, and something that a lot of people are really looking as an alternative. And so the private side gives you a little bit more customizable approach. To get on one of these private plans, they do ask medical questions, and they ask questions about your budget, your health, the kind of coverage that you need, your goals, and all of that is to really give you a plan that really fits for you and fits with your budget, and that's kind of cater to your family's needs, because it's not one size fits all anymore. So that's the advantage of having a private plan. What I would say is just look into it and see if private would work for you better, or if public would work for you better. And you don't need to do that on your own. Use a licensed advisor, someone like me. I'd be glad to help you, walk you through all of your options, and let you choose the one that's best suited for you. So if you feel like you're paying too much for your health insurance, or you're just confused about your options, contact me. Visit me at alexandracontos.com, or you can message me on LinkedIn, on Facebook, or on Instagram. I'm happy to go over all your options for you, do all the shopping for you, so that you can make an informed decision for you and your family, because your health is the most important thing.